Trauma. She lost tooth number 9, so we're going to be working on number 8 and number 10. And take a look at tooth number 10. Root resorption has already started.
Yeah.
And
yeah, that's what happened to me.
Number 8 here. Wide open apices. So we're going to be using MTA. That's tooth number 10 right here. That's tooth number 8 right there. This 9-year-old patient, female, was referred to me for endodontic treatment of teeth number 8 and number 10. A couple of months ago, there was trauma to these teeth, and unfortunately, she lost tooth number 9, and tooth number 9 was avulsed. Tooth number 8 and 10 were partially avulsed, and they were approximated and wired by patient's dentist. And this is when I saw the patient a couple of months ago. And as you can see, of course, number 9 is missing. That's number 8 and that's number 10. And you can see the fragment, the horizontal root fracture of tooth number 10, and the fragment is right there. Tooth number 8 had Miller class 2 mobility. Tooth number 10, mobility was within normal limits. This was the condition of the teeth when the general dentist saw the patient a couple of months ago. This was immediately after the trauma. As you can see, number 9 is missing. Number 8 is partially avulsed. As you can see, so the dentist approximated number 8 and number 10 and wired the anterior teeth. Unfortunately, number 9, the dentist could not put it back in. It was out of the mouth for too long. I'll show you the condition of number 9 when the dentist got it, by the time the dentist got it. This is the CBCT that was taken after the trauma, and you can see tooth number 10 with the horizontal fracture right there. And again, you can see the horizontal fracture here, tooth number 8 here, number 10, of course, missing. Here's the panel of the patient that was taken by the dentist. And again, you can see tooth number 8 and tooth number 10 right there with the horizontal fracture. This is the avulsed tooth number 9. And you can see that just it wasn't possible for the dentist to put the tooth back in because it was out of the mouth for way too long, unfortunately. Went ahead and discussed options with the father. And of course, this poor child is only 9 years old, so she's not eligible to receive a dental implant yet. She's gonna have to wear an appliance, a flipper, for a few years. And the goal is to try to save these teeth for as many years as possible. Despite the fact that they both have very guarded prognosis. These teeth are, it's possible for them to develop ankylosis and inflammatory resorption, of course. So father said, let's just go ahead and try to see if she can keep these teeth for as many years as possible hopefully until she's eligible. She becomes a good candidate for dental implants. And that's what we did today. So we went ahead and sedated her, IV sedation, sedated her, and did both root canals and permanent buildups in one appointment, of course. And we also, we had to do MTA here. So MTA plugs, gutta percha, and sealer, and then place the permanent buildups, all of course in one appointment. Take a look. All right, and here is the post-op. So that's MTA, of course, here, and here MTA plug, gutta percha, and sealer. That's not a gap, that's calcium hydroxide. And we placed the permanent buildups too. As you can see, we got a good apical seal with MTA. So hopefully we can save these teeth for her. Hopefully she'll have these teeth for a few years. She'll have them in her mouth for a few years until again she is old enough that she can, if she lost them, then she can get, if she had to lose them, then she be able to get dental implants here. But as you can see, everything went great. I wrote a report to her dentist. Her dentist needs to do regular checkups on these teeth to make sure that they're okay, ankylosis and inflammatory resorption is not happening.